Hello, my name is Victoria. I'll be your nurse for today. Do you have to empty your bladder before we start?
No.
Okay, sounds good. I'm gonna close the blinds to give us some privacy. Okay, perfect. Sounds good. I'm gonna start off by sanitizing my hands, my stethoscope. And I'm gonna put on some gloves as well. Okay, perfect. Can we start off with your last name?
Dan Williams,
And your date of birth?
1968, July 12th.
Okay, I'm gonna check your wristband. That number corresponds to the one I have on my chart, so that's good. So I'm here to do a head-to-toe assessment on you today. Do I have your consent to touch you? Okay, thank you. So I know that you're here today because you have some shortness of breath, sore throat, and some ear pain, right? So a few questions before we start. When did these symptoms begin?
About 3 days ago.
Okay, and does the pain in the ear radiate to other parts of the body?
No.
Okay, are you taking any medication to cope with the pain?
Just some Tylenol.
Some Tylenol. Do you have any known allergies to anything?
No.
Okay, sounds good. Is the Tylenol helping you?
Yeah.
Okay, perfect. So I'm going to begin the assessment by doing an ear assessment first, okay? So just please move your hair back. Thank you. So I'm looking at the ear. I don't see any lumps, bumps, bruises, or lesions. The ear appears to be a good color, a color that corresponds to your ethnicity. I don't see any cerumen or discharge either. I'm going to check the other one as well. Okay, perfect. I'm now going to palpate the ear, the auricle and the tragus. Do you feel any pain?
Just a little bit of tenderness.
Okay, and the other one. Okay, so I didn't feel any lumps, bumps, or any masses. So I'm now going to check the internal ear as well. Okay, so I did notice some pinkish areas, so that could be an indication of an infection. So that could be the reason as to why you're experiencing some ear pain. Okay, so now I'm going to perform the hearing test. So I'm going to whisper 3 words into the other ear while you're clogging this one, okay? And you recite it to me after.
Cat, dog, banana.
Okay,
Monday, Tuesday, Friday.
perfect. So there's no impairment in your hearing, so that's really good. Now moving on to the sinuses. So I don't see any lumps, bumps, bruises, or masses. I don't see any crusting or any discharge. So that's good. I see that the nose is symmetrical. I'm now going to palpate the sinuses along with the maxillary. Okay, so I didn't notice any lumps, bumps, or any masses, so that's good. Now I'm going to do the smell test. So what I'm going to ask you to do is hold one nostril, keep your eyes closed, and I'm going to give you something to smell, and you let me know what it is for both sides. Okay. Do you know what that one is?
Alcohol.
Perfect. And the other one? And this one?
Alcohol.
Perfect. So there's no impairment in your sense of hearing, sense of smell, so that's really good. Now moving on to the mouth assessment. Okay, so I see that the lips are pink in color. The moisture level is good. I don't see any lumps, bumps, bruises, or lesions, so that's good as well. Now if you could just smile big. Okay, I see that the teeth are white in color. They are good in shape. I don't see any abnormalities in the teeth. They seem very strong. Now I'm going to ask you to open your mouth and I'm going to check your gums. Okay, the gums are pink in color. I don't see any bleeding, any swelling or anything like that. There's no gum looseness either, so that's good. Now I'm going to do the glossopharyngeal test, so just open wide. Okay, and say ah.
Okay,
Okay, so the upper palate rises, so that's good. And now I'm going to do the glossoperineal test as well. So just move your tongue, open up, and move your tongue from side to side. Okay, and now say light, tight, dynamite.
Light, tight, dynamite.
Perfect. So everything seems to be good in that department. Now moving on to the neck assessment. So I see that the neck is, the trachea is midline. I don't see any enlargement of the thyroid gland. I see that the skin is white in color. I don't see any lumps, bumps, bruises, or masses, so that's good as well. Now I'm going to palpate the neck. Okay, so the temperature is warm to touch, so that's good. The skin moisture is also good. I didn't feel any lumps, bumps, bruises, so that's good as well. And now we are going to do the spinal accessory test. So just shrug your shoulders for me, please. Up and down. And now I'm gonna apply some resistance and you do the same. Perfect. Okay, so I didn't notice any struggles, so that's good. Now moving on to the upper extremities assessment. So looking at your body, I could see that you have a good muscle build. I don't see any skeletal deformities. I don't see any joint deformities either. I see that I don't see any lumps, bumps, bruises, or lesions either, so that's good. So now I'm going to palpate. Okay, so I didn't feel any lumps, bumps, bruises, or lesions either, so that's good. Now moving on to your fingers, I'm going to do the capillary refill test. So I see that it is 2 seconds, that's good. I see that the nail color is also good and healthy. The nail form is good too. I don't see any abnormalities in the nails. Now I'm going to ask you to do the range of motion test. So if you could stand up for me, please. Okay, perfect. So we are going to begin with your hands. So just put your hands out, your fingers expand, and okay. And now your wrists up and down. Perfect. And now we're going to go in with your elbows. So yes, perfect. Now you can put your arms down. We're gonna do the shoulders. So you're gonna put your arms like this, okay, and then like that. And now you're gonna rotate in, yep, and then back. Okay, perfect. You can now sit back down. I didn't notice any struggle or anything like that. Everything appears to be symmetrical as well as you're doing it, so that's good. Did you feel any pain?
No.
Perfect. Okay, so now we're going to move on to the thorax and the lung assessment. So I'm going to ask you to sit back up again, please. Okay, and I'm going to move your hair to the side. So looking at everything, I don't notice any lumps, bumps, bruises, or lesions. I don't see any scars. I see that the ratio, the AP ratio is 1 to 2. I see that it is symmetrical. Your chest build is also good as well, so that's good. So now I'm going to palpate. Okay, I didn't notice any lumps, bumps, bruises, or lesions. Your skeletal build looks good too. So now I'm going to osculate. Okay, perfect. You can sit back down. So I didn't notice any work of breathing. Your breathing seems good. Your respiratory rate appears to be at 12 beats per minute. The rhythm is also good as well. So